family.
Welcome in.
Hope everyone's doing all right. Welcome to Taking Wellbeing Virtual Part 2. I'm Josh Downing, Director of Recreation and Wellness at Butler University, and co-facilitating this with my colleague.
Hi, everybody. My name is Darcie Burde. I'm Director for Fitness and Wellness at the University of Florida.
All right, just real quick, before we open this up, want to remind everyone that this session is being recorded and will be posted to the NIRSA website. The link's right there. You are muted. Just make sure that you remain muted, and then when you want to talk, just unmute yourself. The chat box is key to all of this. Make sure to drop in your questions and comments, drop in any links in there. Darcie and I will be monitoring that and calling in people as we see fit. Continue to utilize NIRSA Connect, and NIRSA Connect's been key for this time for all of us, to further the conversation and for resource sharing. It's a roundtable type discussion, part 2 of this. And if you were on the first, I said I'm imagining myself at Phoenix at our national conference, sitting in a big room with all of you sitting around in a circle, and we're just talking about this. So that's how I'm kind of viewing this. I'm not standing in my bedroom right now. The quick guidelines, just remember everyone's kind of different point with this. This is a no judgment space, and that we NIRSA are here to help each other. Part 2, this is kind of where we want to go with this. There's been tons and tons of great resources shared already, so thank you. Reminder of the virtual wellbeing resources that Victoria from University of Texas, San Antonio started. That link's in the chat box. Reminder of the health and well-being in higher education statement, a commitment to student success. This is an inter-association statement. Dropped a link in there as well. Just want to make sure that you're all aware of this, because we're looking to take this conversation beyond campus rec today. So we want to discuss a holistic and integrated approach. Darcie and I are part of the NIRSA Health and Wellbeing Task Force, and I'm guessing there's a few others on the task force that are on this. And we started about a year ago. Actually, it was a year ago. And one of the big things that we started out was a survey, and that survey is available. I dropped a link in the chat box as well. And then continuing our work, we formed a cross-campus integration work group as part of the task force that Darcie and I are co-chairing, and many that are on the work group are on this call as well today. And kind of our main thing is developing resources to foster top-down and bottom-up support on campus of building foundational knowledge to enable effective cross-campus collaborations. So that's really where we're hoping to go today. Before I turn this off, just a few topics to get us started. We want to talk about how we can engage campus stakeholders and partners outside of campus rec, whether it's counseling or the career office or academic support with whatever it is. Again, beyond campus rec and wellness, we really want this conversation today to be centered around that. So we want to hear what you're doing, what some great examples are from various spots across the country. So make sure to share those in the chat box. Talk a little bit about how we need to get top administrative support, how this is really building a community. We're on a roundtable the other day about that's really what we're doing, is we're trying to build a community. And if we have time at the end, talk about kind of what post-COVID is, whether that's this summer, this fall, or next January 21. So without further ado, and this is the best part of doing this, is I'm going to stop the share so we can all see each other, which is awesome. So, hey everyone, welcome. It's great to see everyone. I see a lot of familiar faces, and I see a lot of new faces. Love it. NIRSA family, best part of all this, and now more than ever, we need each other in really big ways. So yeah, so I'm going to stop there and open this up. So if anyone has anything they want to start with, or I might turn to some of my task force and work group colleagues to really get this conversation going. And we want to talk about, start off with talk about how we're engaging campus stakeholders and partners. with this. If anyone has some great examples of what's working and what's working here in the last month.
Hey, it's Greta Ledoyen from Embry-Riddle. Things basically broke down and everybody went back to their original silos. But everybody started sharing everybody else's. So right now it's very small, but like counseling is sharing ours and the dean is sharing ours, even the, like it kind of went all the way up through the chain. So everybody's sharing the same message. Our president sent out our last university communication was a list of here are the great resources. This is what Counseling Center and Fitness Center are doing. He combined those two, which I was very grateful for. And here's what the Dean of Students is offering. Here's what Res Life is doing. So they gave out a whole list of resources in one communication saying, students, we're here for you. I thought that was a big boost to the campus-wide conversation.
Great, thank you.
This is Natalie O'Farrell from the University of Arizona. I agree as well with that statement. We've kind of been very siloed, didn't work a lot with our employee relations group or well-being, and now we are step together and working together on different items that we didn't do before. And so there's actually a new committee, a health and wellness committee, that had kind of not gotten any traction, but as a result of this, the whole campus, even the medical school, is working together to provide resources. So it's been a good thing. Unfortunately, it has a result of the COVID-19. So.
Great. Hey, Jess at Princeton, do you mind talking a little bit about what you shared?
Sure. Hi, everyone. Our Vice President for Campus Life, at Princeton University, I report up through athletics, who reports directly to our Vice President for Campus Life. And she has made, she has put together her strategic plan for 2020-2025. And one of her key goals and objectives is prioritizing health and well-being, making it an institutional priority for all of students and faculty and staff. And it's clearly stated in her strategic plan. She's put this, she's really tasked everybody across all of the different campus life units to work collaboratively on this effort and how we can, do this more in a holistic way as opposed to everybody doing their own, programming. So, which has been really nice to see from the top down that this has become a priority. And she's really engaged all of the different units to work together with this. And it's just been nice to see because it's really been, the report came out in October, the draft, and just to see all of the different units really trying to work strongly together on this as opposed to everybody thinking that they own it has been really nice because she's made it a clear priority for the entire, for all of our different units that report up to her, which has been great. So I shared the link to her website so you can kind of scroll through it. She has a great video on it. She has her full report that's up here and kind of talking a little bit about how we're going to implement this, things that we've already done, things we're going to be doing moving forward. It's just been really nice to see it all come together. So.
And Jessica, can you share a little bit as well? Do you happen to know some of the background on how she made that decision? What information was either pushed up to her about that, or if that was something that was a vision of hers to create?
So what was really great was she created a lot of subcommittees to work on this strategic plan, and I actually got to be a member of one of those subgroups. And we met with an external consultant who helped us kind of put this plan together. And we had a lot of focus groups, we had a lot of conversation around everything that's in this plan. And it kind of came up organically that way, and which was really nice to see. I mean, she's a big advocate for everything that we do already, but it was really great to see the way this all kind of developed, because it came from the students, the alumni, the faculty and staff, and people just talking about it. And as different themes came out of a lot of those meetings and conversations, we were able to put this core group of different priorities together. And this was kept coming over and over and over again of how the campus really wanted this as a priority for everything that we're doing. And what's nice is we're really focusing on what we can do from a staff perspective with faculty. That came up quite a bit, is that the students are so stressed in the classroom and that we need to engage the faculty in all of these conversations, and how can campus life staff do that as well. And a lot of great conversation has been coming up with how we can partner with the faculty on getting this messaging in the classroom as well. So it's been nice to see.
Hi, this is
Great,
Lynn from University of Oregon. One of the
Hey, Lynn.
things, yeah, hey everybody. I'm on the, I guess, sub work group of the Health and Wellbeing Task Force with Joss and Darcie. So one of the things that I've shared is a collaborative arrangement. So let me set this up first a little bit. The University of Oregon has a unique alignment with certain units. So physical education and recreation reports up through student life, the Division of Student Life. Our key partners in our quest for furthering the health and well-being on our campus are in another division. So our counseling center, our health center are in a completely different division. So it's an interesting way to try to break down what silos might be there. So what I've done with our executive director of the University Health Center is form what we're calling a Wellbeing Consortium. So we started this in the fall. This group strives to be a driving force for positive change in the individual, interpersonal, institutional, community, and policy aspects of well-being for University of Oregon students, faculty, and staff. So if that sounds a little bit familiar, it's because we're using the socioeconomic model for our work. So some of the things that our group has been talking about is identifying the well-being gaps that exist with our students and our faculty and staff. We know that there are achievement gaps. What are the well-being gaps? We know some students are able to overcome adversity. They're able to thrive at a higher rate than other students. So what are the resources that we can provide? And a lot of this is not just the key players. You know, we need to be thinking about university-wide, what kind of policies, what kind of cultural shifts can be made with a well-being focus around not just for students, but for faculty and staff. A couple of the other things that we would love to see that might take a colossal effort is, for an example, an undergraduate course around a well-being cluster. So a course requirement that's either a physical education or some sort of well-being related cluster. Currently that's not required. We'd also love to see more of a focus in holistic well-being around the natural and built environments across campus. So in our group, we've pulled in our director of campus planning. So we've been pretty strategic about trying to keep our group of this, cross campus, to integrate cross campus, keep it somewhat small so we can actually get everybody in a meeting on a call together, which is a challenge. But we have key players that are, decision makers in their units, quite frankly, and we have some other individuals. We also have some student representation. So we're really excited about where this group is going, the momentum we've built up. We've hit a bit of a pause with having to deal with the stay-at-home orders here in Oregon, and navigating that, but we're all very passionate, and the work will continue. So I can share more out as time unfolds and as we move forward with that work. I'll turn it back over to you, Josh.
Hey, Kevin, do you want to kind of speak to the 2 links and the information that you shared in the chat?
Sure. Yeah, we've been working on our well-being initiative called Row and Thrive for about 2 years. We really didn't get university support until this past winter time, when we unfortunately had 4 student suicides on campus, which caused our upper level administration to see not only do we need more counselors and reactive support, but we also needed to get in front of this and really take care, using the kind of terminology of the upstream model. So we've been building this momentum, doing the ground up, and working on getting activators or people willing to jump on board. And then as we were building momentum and the crisis happened in the fall, with a lot of crises that are happening on campus with mental health, we were able to get president and VP support. So part of the initiative, we had a 3-month summer challenge for our employees, because we doubled in size in 10 years. So we went from 9,500 to 19,500, and we haven't necessarily doubled our resources and staffing. So our staff are also feeling a little bit of stress in their well-being. So we did a 3-month challenge voluntarily. 600 employees signed up. 250 did a 3-month well-being challenge, listing their 6 dimensions of well-being and setting some goals. We also correlated a weekly email to remind them and send out a MailChimp newsletter. What we did was took that newsletter and we transformed that into a well-being newsletter called Row and Thrive, and we've actually had 4 editions now, and the response has been great. I think they said higher ed open rate is like 15%, and we've been getting about 40% open rate. So about 10,000 people have opened it for the 21,000 it goes out to. On top of that, we actually launched our website and now have support from our Rowan Media Public and Relations team to kind of clean up and assist us with that, because we're all just volunteering from the Rowan Thrive Committee. There's about a dozen of us from various units, mostly student affairs. And then our next step really now is just continue to work with academic affairs, student affairs, administration, and finance to continue this support. Right now, there's a hiring freeze and there's no writing on the wall to get a full-time professional chief. Chief of Wellbeing is a big title right now. So right now we're still all kind of doing our departmental responsibilities while contributing to a larger goal of being proactive with the wellbeing initiative. But I sent a couple of the links out. Our student success team has also created kind of a thriving in a new normal with kind of remote learning and some tips for academic learning and out of the classroom learning. But we're just navigating like everybody else the budget implications of this. We have about a $25 to $30 million shortfall with all the credits and the refunds that were given out for housing, dining plans, and parking. And so right now we are anticipating maybe not having a budget, and everything will be by request only. And that's challenging with our $5 to $6 million budget, which is a very nice, healthy budget.
Thanks, Kevin. And yeah, very, very much, I'm guessing a whole lot of us, if not all of us, are dealing with what you just mentioned. So very much top of mind for all of us, and why this conversation is more important than ever. Kind of going back a little bit to Lynn and taking this a little step further, curious to know if any university has well-being in the overall university strategic plan, strategic priorities. Is it a conversation right now? Is it something within the overall department, say, not department, but like division of student affairs? A little bit, we could also get a little bit into learning outcomes, if this is being a broad approach with learning outcomes with well-being. So kind of curious to hear maybe what some successes have been or what's being talked about, and I'll mute myself and let someone jump in.
Hi, everybody. Marcy Iverson from Viterbo University, small private faith-based institution in Wisconsin, also serving on the Health and Wellbeing Task Force. With the launch of our institutional strategic plan for 2020, 2025, employee and student health and well-being were top priorities and initiatives. So that was from the ground up and the top down. And it is embedded into the university strategic plan. We have formulated and been working with our Wellbeing Coalition is what we're formally calling our group at this time. And we're starting with our framework. The group at this point in time is a mix of individuals from across campus. It's very broad and deep. It includes students, faculty, staff, administrators. And right now we are, like I said, focusing on our framework as a collective, but independent of that, within the Division of Student Affairs, which recreation, student life, health services, counseling services, we all report under the same umbrella. We have well-being within our mission statement as a division, as well as built into our learning outcomes as a division. So we had written learning outcomes when we obtained a new vice president about 3 years ago, and the health and well-being was a umbrella, and we have targeted outcomes related to that we've been working towards over the last few years.
Thanks, Marcy.
Here at Purdue University, my name's Will from Purdue. We do have an integrated well-being pillar, what they're calling it, into our Division of Student Life. I wouldn't say it's in the university strategic plan as a whole, but it is part of, it has made it all the way up to the point that high officials on campus are being assessed by the effectiveness of this program working, I should say. And so with that, I think it's opened the doors for a lot of collaboration that before was just siloed. I think what our leadership here has done is created a network that's not too structured, but not too nebulous, and that it allows people from both the academic side and the student life side to join forces and really work collaboratively in pushing forward for well-being. We have, through the launch of this program, been able to work with different campus partners to kind of rethink what well-being means at Purdue. For instance, we're working with orientation programs right now to really make sure that from the very first moment new incoming students hit campus, that well-being is a factor that they know is important here at Purdue. Our vice provost's office is sending out newsletters every week to staff all over campus. There are online modules that our office has been working with the vice provost's office to create for well-being. And those are both self-paced or they're easily downloaded for faculty to use and include in curriculum in the classroom. It's a relatively new program. I would say this is, it's been in development for a little over a year, and we were part of the planning process and going to brainstorming meetings, deciding everything from helping decide the name to working with what's it going to look like and asking questions and pushing back to some of our leadership for what does this mean for us and how do we implement this if this is the direction that we're going. But all in all, I think it's been a positive step towards creating a unified front for holistic health and wellness at Purdue.
Thanks, Will. Eric Nickel, I'm going to pick on you. Eric Nickel at James Madison University. I think he just put something in the chat room, so I beat him to it. So I'm going to turn it over to him. He's got some good stuff to share.
How are you? So one of the things I shared yesterday was, for many of us, the notion was that student health and well-being was the purview of either the department with that name or the Division of Student Affairs. And one of the things that we were able to do this year, we have a list of what we call core qualities in our strategic plan at JMU. And there were 10 of them. And this year we proposed an 11th for student health and well-being. And we kind of struck while the iron was hot. what we found in the past was that faculty members, administration of finance, and advancement, the other divisions, all saw that as our work. And until they had connections to their own work, they weren't really interested in taking responsibility for that. But with the onset of some of the things that have been happening in the last few years, a big increase in student withdrawals, academic withdrawals, disruptions in the classroom, students seeking out faculty members in their office hours for what amounted to, what they thought was counseling support sessions, as well as the administration and finance folks talking about the lack of resilience of students and its net effect on tuition and fees. We got some buy-in that it was an institutional issue, not a divisional issue. And for us, that was a major turning point. So now with the president including it as one of the 11 core qualities, one of the things we use that strategic planning document for is to create our departmental plans. Every dean, every department head uses this document to link their strategic objectives to this university strategic plan, and that's what we report to SACS on. So now every division has a responsibility for writing objectives to help with student health and well-being. And for us, that's a major change. I mentioned yesterday in the call that in the past, if a faculty member saw a student crying, they immediately sent them to the counseling center, that was their job to fix. And so we've done a lot more empowering of faculty members and what should you do when these kinds of things happen, and what things can you handle upstream before they become withdrawals and student discipline cases and other things. So it's been a really interesting process. We're really just in year one of it. But I'll tell you that the institutional commitment has made a big difference, not only in terms of funding, but in terms of spiritual support from the other divisions. So this is a campus effort. And for those of you whose counseling center is still just drowning in people, and it seems the only people that are worried about that concern, it's a big relief to my colleague, the director of the counseling center.
Thank you, Eric. And I wouldn't be remiss if we take this quick opportunity to congratulate Eric, as he is our NIRSA Honor Award winner. So if we all can give him a virtual congratulations. Appreciated everything you've done over the years for us, Eric. It means a whole lot to many of us, so thank you.
Thanks. Well, sorry we won't get a chance to hang out this Friday, all of us.
We'll make up for it, or more than make up for it, the next time we're together. With what Eric was sharing, I'm curious to know any other universities kind of in a similar boat or having kind of a similar approach to what JMU is doing, and want to share what that is.
This is Greg Reinhardt with the University of Utah. I would say the closest thing that we have to what Eric mentioned is within student affairs itself. It was required of every unit within student affairs to assign at least 2 professional staff members to become mental health first aid certified, so that we had individuals within our units that could help guide students through situations, and certainly refer to the counseling center if needed, but kind of like Eric mentioned, not just having it be an automatic response to do that. And that's been an initiative that was started in the spring, and so we haven't really seen it through in terms of everyone getting certified within the division or seeing how it affects things, but it's something in the works.
I'd like to take a step back then too. So for individuals who might be at institutions who have not been able to get upper administrative support as of yet for these, what are current projects, committees, services, what are different things that you are seeing some collaboration start to occur with that you are hoping is going to result in it being escalated to upper administration? What great work are you doing? Points of pride right now. It doesn't have to be at the top yet.
Okay, I'll jump in. I don't know that it's definitely not at the top yet. This is Lynn Thompson, the University of Illinois at Chicago, and we're definitely not at that level. Some of the things that I've tried to do to just kind of bring it more collaborative is through the ACSM's Exercises Medicine initiative. So just creating those contacts between kinesiology and our healthcare system and trying to work through those routes. Additionally, it's really siloed. And so I find ourselves as a resource for several different units to assist with it. It's almost as if each different area has their own wellness initiatives for their employees. And so they'll reach out and we'll help with wellness challenges or newsletters or things of that nature. But it's just, it's really more of a siloed approach right now. And I hope that at some point, I mean, we have a very strong strategic plan in student affairs, and all of those things that Eric mentioned, we do, but unfortunately, the closest thing that you would find to wellness maybe is student-centered culture. It's almost like you have to like pick through the learning outcomes to see where you can like fit it in, if that makes sense. So still working towards that. Definitely not there yet.
Yeah, that's great. Are other institutions, are other folks on here utilizing different types of commitments, partnerships with outside organizations to start achieving and gaining some traction in different capacities as it relates to health and well-being?
This is Greta from Embry-Riddle again. Kind of. We've got an organization that likes to fund things that are heart healthy. So we've used them a couple of times, and they're kind of on our roll now, and they really want to get involved in the college side of things. Before all of this pandemic thing happened, we were on a roll with philanthropy to gain some funding and resources to help build an outdoor wellness fitness court. We had some support from bigger places than just us within the institution and outside. But now all of that, like everybody said, pause. Don't talk to me about this until we know what we're gonna do. So yes and no. I guess we have some of that support, and right now it's not there, but I don't know what is still in place in terms of even our department. So going back to the committee work, we do have a committee started that started this year to gain that global, campus-wide, worldwide approach to our wellness, and that was started underneath the direction of the Dean of Students. So she's kind of piggybacked off of some of the ideas that I've shared over the last couple of years, and she has the power to make things happen, which is really, really nice. But we are just taking inventory and seeing, somebody else mentioned early on, what are the needs? What do students perceive are their needs? Not just what do we see is the gap. So we're trying to get connected with the students themselves to hear what they have to say about it.
Something I would like to add from the University of Oregon, it's not through our PE and Rec department, but our University Health Source has been able to create a special space called the Duck Nest. It's a wellness center. We wish it was 18 times larger than it is, but it is funded through, by and large, through Pacific Source Health Plans. So it's a great partnership with that group wanting to provide funding around proactive, holistic health and well-being. and we as a department help with some of the programming that would take place either physically in the duck nest or the outreach efforts. A lot of times you need to meet students where they're at. So it's not necessarily them coming to a specific space, but meeting them where they're at now, especially virtually in the remote realm. I would like to circle back, and one of the challenges, and I really love hearing how there's institutions that have health and well-being being a focus from the top down and bottom up. I don't feel that there's, quite frankly, an emphasis from the top down. There's a lot of emphasis around the mission of teaching and service, research at our institution, and then there's specific student outcomes. However, none of the student outcomes or the mission will be achieved or can be achieved at its highest level if we don't have the foundation of health and well-being for students, faculty, and staff. So that's kind of the work that we have cut out for ourselves and for our well-being consortium is really getting the buy-in from the top down. I think we have it bottom up. So if there's any words of wisdom out there from anyone on the call, let me know. Thank you.
I was just going to mention, and again, I brought this up to the task force group yesterday, and this idea of how you go about it. And one of the things that I found to be true over the years is you had to speak the language of the people that you were trying to convince that it was an important thing to get their buy-in. Because, you know, for too long, the counseling center handled all mental health issues. And before it kind of affected their world, before it affected, you know, tuition and fees because of, you know, our withdrawals at JMU went from about 100 a year to over 400 a year for withdrawals for various reasons, but a lot of them breaking down to student mental health. So you do have to kind of frame your language. We tend to talk about it from our perspective as recreation providers of, you know, from the choir, and we expect to resonate with anecdotal stories about what that impact is on students and kind of the right thing to do. And to be honest with you, VPs for administration of finance and provosts don't necessarily live in those same worlds. They live in a very practical world about, you know, if you're the administration of finance person, it is about how is this going to affect my bottom line? So we looked at the opportunities to speak their language and talk about the loss in fees and tuition, and in our case, you know, the acceptance rate having to go up to maintain our student class because of a lot of issues we're having with student resilience. So finding a language that resonated with them, speaking to the provost in terms of academic program withdrawals, and to the vice president for administration finance about their issues with tuition and fees, and even to the advancement folks about parents not wanting to give when their students are relaying stories about their frustrations with certain services not being available on campus. All those things help make that case for folks who didn't normally see this as their business. And I think that's our job, whatever task forces we have, is to speak the language of the administrators that we're trying to get involved in, you know, taking part in this journey with us.
Discussing, and then
So I think part of speaking the language too comes to figuring out what other needs administrators also have, right? So one example that occurred, it started about 2 years ago at the University of Florida, was that the president spoke to his cabinet and asked for, you know, how can we reduce our metrics surrounding sexual assault on our campus? And that resulted in our health promotion office as a big players in this, but that falls within recreation at UF, answering the call, and it was a comprehensive work group that did a lot of literature reviews to figure out what was going on campus. So we're utilizing things like Green Dot, like the Partnership for a Healthier America, like Exercise is Medicine, to try and help bolster it, so that way we can see, okay, hey, if a priority is being asked or if something is being addressed, how does that trickle in, and then how do we connect? You know, I've heard some great feedback thus far about working with faculty. That's a big challenge we have. We're a huge institution, and striving for top 5 means our priorities are on retention rate and graduation rate and you know, different metrics like that. But as Lynn mentioned earlier, we can't achieve that if our students aren't well. You know, if we're having to triage students because our mental health services are absolutely overwhelmed. So, you know, we're working hard to try and speak different languages, offer different collaborations, and work with different colleges, different entities on campus to bring that together. One result of some of those efforts, but more importantly, even broader efforts within the division, and I can post the link here, is how we are working together during this coronavirus crisis within student affairs. So all of our student affairs units, and Greta kicked it off phenomenally, and I wanted to kind of like jump in there, but I also wanted to be patient and let everyone else talk. But as opposed to, you know, the siloization that occurs and we do our own work really well, right away off of, you know, us deciding, okay, we're doing virtual offerings because we're all not going to be on campus, our marketing and communications for our division said, let's put this all together. So we have a virtual student union right now where students can go to one location and then all of the components within student affairs are there. So like, hooray for working more closely, collaborating, but actually seeing ourselves work more cohesively as a unit. So that's definitely one win that we have had come out of the current situation. And I'll toss that link in.
Before my supervisor retired, when we started this initiative 2 or 3 years ago, we strategically set up meetings with probably 30 different areas, so student clubs and orgs and departments and like our strategic priority council. And each one of those presentations, we kind of catered towards the audience. And I think that was important, knowing what was, you know, why well-being is important. We talked some stuff in NIRSA, ACHA on the upstream approach. But I think that was impactful to kind of have a room of 15 or 20 or 30 people. And like I said, that kind of working from the ground up if we weren't going to get university support from the top down. So that obviously took some time and commitment and coordinating people's schedules. And some of them were 10-minute quick hitters because it was part of a larger scale meeting. Some of them gave us 45 minutes to an hour to have a nice lengthy, not only presentation, but a two-way dialogue. And a lot of times when we presented to employees, it always came back to, but what about us? What about us? I mean, we are student facing and our budget's very healthy because of obviously tuition and fees, but it always came back to the employees. So we wanted to make sure we did a two-pronged approach, knowing with our union shops and sometimes the challenges of all the different faculty staff and AFT and CWA and different unions, but we still wanted to make sure there were some low cost or free options that we could initiate for employee well-being. But I think those kind of 30 presentations we were able to do within the last 2 years really helped build momentum. And then, like I said, timing-wise with our fall, we were able to get institutional support, not only with SGA supporting like a wellness referendum fee, but other kind of support.
Other universities or colleges that have had success, whether you're just starting out or you want to share kind of what you're doing at your campus to get this moving forward, and has this current situation fast forwarded any of that conversation at your campus or maybe slowed it down?
Hi, my name is Valerie Canis Gonzalez and I'm from CSU Chico. We recently put together, so a lot of the student leaders, we have part of this like core team with all these different areas of outreach, whether that be through social media or just relationship in general. So we have like our cave, our Wildcat Leadership Institution, our rec and everything like that. And we have weekly meetings where we put together our curriculum or things that we're sharing with our university campus. And we're supporting each other in that, which is a beautiful opportunity to really become like a cohesive network for like the holistic wellness of our students. So whether that's like Netflix Zoom meetings through Cave or different opportunities like that. I think, however, and maybe there might be some advice on this, we pose a lot of questions to our greater student body, asking what are the wellness tips that you would like to know about, or what are some ideas that you would like to hear more about. And getting that response from students has felt very difficult. And even like greater student engagement, there is some, but considering the state of everything, there are still a lot that are unaccounted for. So if you have any advice or experience that you may have had with this, I know I would greatly appreciate that.
Hi, everyone. I don't know if someone's talking right now. This is Richard. I am from California State University, Northridge, the Oasis Wellness Center. I run the center, and we started jumping on this whole providing virtual programming. We sent telecommuting agreements to anyone who wanted to facilitate virtual programming. And the SRC, the Wellness Center, the entire USU. We are auxiliary from campus, part associated students. So all of our centers, the Resource Center, the Veteran Center, the Student Rec Center, the Wellness Center, have all put together virtual content, like the playlist, yoga, workouts, as well as resource page. Like when they land on our page, these are some resources and FAQs for students to, whenever they land there, like, you know, DIY projects, what can I do? But what we've been learning, and similar to what you were sharing from Chico, Valerie, is that I personally made it myself available to have a live Q&A session. We use MindBody. We're able to put a link that when students register, which is where they usually register for any workshop that we've had. When students register, it sends them automatically the Zoom link. So it's very automated in a way. And so I've been logging in to have a mindfulness and well-being Q&A. I also did a poll with my own student staff that, you know, what would they like to do? And what I've learned was a lot of them at first, in the beginning, most of them would log in to virtual content. They preferred pre-recorded content versus live. But what's happening now is that they are getting fatigued from everything being virtual. So it's important to go back to that face-to-face virtual one-on-one. And that's where I'm finding like people just logging in for, we have an affirmations Monday. Thank God it's Friday meditation, TGIF meditation on Friday is very loose, happy kind of thing. So Monday, the affirmations get them going. Wednesday is the Q&A, and Friday is like, yay, we made it another week kind of thing. So what I'm hearing a lot has been that virtual fatigue. So I just sent something to our marketing department to post how to overcome this virtual fatigue. But I'm new to NIRSA, and I just want to say I'm loving this cohort. I love this whole holistic approach. Mindfulness, gosh, it's just amazing. So I'm happy to hear what everyone's doing, and loving this cohort. I'm also part of a council of directors from campus, and we are meeting every other week to see how we can help each other, facilitating each other's workshops, cross promotion. So there's a lot going on. So yeah, that's what we are doing. Might not be the answer, but I'm still wrapping myself of how to make things maybe like shorter videos that we're putting on because of how limited people's attention is to virtual, and also maybe providing it as a pre-recorded programming or offering.
Richard, thank you. Really appreciate it, and glad you're joining NIRSA and a part of this. And if you can do me and all of us a favor and drop in the link to the Oasis, if all of you, or if you have not checked this out, definitely check it out. A lot of us over here in Indiana have a crush on the Oasis, so I'm guessing a lot more people will too. So, so yeah, we're getting towards here the last few minutes of our time together. Maybe this is a good time to talk about a little bit and see if anyone is starting to have conversations of post-COVID. I don't even know if you can really say that, but they're starting to hear that this virtual world is going to continue on when we return to, I don't want to say normal, but back on our campuses and back doing what we do. This virtual world is likely to continue. There's conversations of some universities that potentially are going to do their first year for first year students being virtual, and then the last 3 years they come on campus. Are we going to start seeing more students choose this virtual offerings as far as their education, but want to still be well connected to the campus? We've heard of virtual student fees. So utilize the offerings being presented by whether it's campus rec and well departments or other partners on campus. Even heard of a virtual student affairs fee. So just kind of curious what people were thinking. If you're having conversations at your university of thinking in the future and how you potentially could continue on or even add to what you're doing.
Well, I'll jump in real quick, Josh, and just say that our conversations thus far have pretty much entailed what a phasic approach might start to look like when return to campus occurs. We have a feeling it will be similar to the capacity that exiting campus was. Or in the reverse, I should say. So students left first and then faculty and staff. And we imagine that at some point we'll have faculty and staff more on campus and then students. How that impacts programs and services, we really haven't had many of those conversations as of yet. So I would be curious if other individuals are experiencing similar components or if it's just very much right in the here and now, right now.
I'll jump in with one quick thing. So just looking, even just in the short term with like just summer scheduling, what does summer even look like? So we're currently kind of doing a dual planning session for online and, virtual. What does the virtual program continue to look like? And then kind of phasing in person, obviously back to normal-ish program look like. So we have basically running two platforms, preparing for two platforms for as long as needed, and just continuing to, I do see us probably building a continual virtual programming, if you will, that will continue in some capacity. I don't have an answer for what that looks like right now, but I do think that futuristically, it will definitely be a blended approach moving forward that probably will continue, because we've always talked about how do we engage our commuter students, or how do we have a lot of commuter students at UAC. So I can see this as a bridge for making that connection moving forward for sure.
Lynn, I'll tag in, I guess. It says we're also planning for both. When we go back in the building and then again where we are now, and how can we integrate the two of them when that day comes. But then going back to Darcie's question, I guess, I'm sure somebody's having those conversations about how are we going to be integrated back into the campus and how is programming services going to start back up. I'm sure somebody's having those conversations, but the communication has not come out yet. We don't know anything beyond April 30th and then summer A. That's it. So we are definitely planning for everything.
I'd be curious, has anyone heard anything? The one thing that I did hear, and this was out of Champaign, not Chicago, but that potentially even when they come back looking at July, that they still would not be able to have programming over 10 people. And I don't know if does anybody have heard any specifics related to that at all? That I've only heard that from one person, and that was out of Champaign. So I was just curious.
Hey, this is Emily over at University of Missouri St. Louis. Our university has canceled all on-campus events and programs through July 31st. So school is already online for the summer semester like most institutions, but also all campus events are canceled until July 31st.
Okay, any other final comments here before we wrap this up?
I have one last question. Is anyone, like, the approach from wellness through human resources, is that like a connection that people have made or are making, or is it all like where does that line up for people?
Lynn, I can speak to that. We are connecting with our human resources. When it comes to the employee well-being component, that is a co-chair. So for our Wellbeing Coalition, our Director of Human Resources is a co-chair with myself, and so is a key player when it comes to the employee well-being work that we're initiating and doing.
And I would add, Lynn, I think that is extremely different from campus to campus. There are recreation departments that do employee wellness exceptionally well. And then there are other ones that, you know, it's perhaps a relationship with whomever does it, whether that's HR or if it's run with a medical center that is a part of the university too. So, yeah, all across the board there.
Great. Well, hey everyone, just to kind of sum it up here as we wrap up, I dropped in Darcie in my emails. Like we mentioned, Darcie and I, and there's others on this call, are part of the NIRSA Health and Wellbeing Task Force, and then we're co-chairing the cross-campus integration work group. So feel free to reach out to either of us at any time. You know, we're here to help, and we want to hear from you as we are really trying hard to move this forward for NIRSA. We can't thank all of you enough for participating today. There was tons of great resources shared, tons of great information shared. You all are doing great work at your universities and campuses. We can't thank you enough. And as mentioned, now more than ever, this conversation is critical and important. And you know, there could be a silver lining to all of this, that what's going on, and that this is pushing well-being to the forefront, and that our campus leaders are going to realize it if they haven't already, and we can strike when the iron's hot. yeah, continue to reach out to each other, support each other. Thankful for all of you. Yeah, and hope to see you soon.
Thanks for attending. Take care, everyone.